Hello, my name is Dr. Bob DeMaria, the Drugless doctor. Today we're going to get to know about cleansing and detoxifying from the head to the toes. We have so much to talk about. We live in a very toxic environment, not only in the United States, but worldwide. And I've been able to travel around the world and see the results of toxicity and how it impacts individuals. So my goal, my plan today is to teach you nuggets and secrets that I've learned over my practice and through my experience that we've been able to help so many patients with. Let's start with the head and your hair. When somebody comes into the office and I look at them, we just start looking and observing. Don't say a whole lot, but if you came into the office and I know that you had thinning hair, chances are you have a low thyroid gland. Probably one of the most significant organs in the body when it comes to detoxifying, because if your hair is thin, chances are you don't have a bowel movement every day. One of the leading causes for constipation is poor or subpar thyroid function. I also look at the quality of your hair and hair color. If you have gray hair, once again, I know that you have possibly subpar thyroid function, because we see white and gray hair in individuals whose thyroid gland is just not 100%. Let's just say that you mentioned to me, Dr. Bob, I have issues with dandruff and my skin is very flaking. What I've seen through time is that individuals who have hair challenges and hair issues with the flaking of the skin, it's usually a body signal to me that you have poor fat metabolism. Well, if you have poor fat metabolism, I know that your liver is not up to par. I'm going to share a nugget with you that is very significant. I always look at our patients' eyes. I look at the iris of the eye. The iris is the colored part of the eye. We have the dot in the center, which is the pupil, and that colored area is the iris. If you were to look at your own iris right now after you're done watching me, if you have real tight fibers, that's a body signal to me that you may have anxiety. The fibers in the iris are really tight, but I'm also looking for yellowing or orange. When I see a light yellow, it could be a buildup of uric acid inside of your body. I'm also, which happens to be a byproduct of poor kidney metabolism, I'm also looking at the white part of your eye. If I have a patient that comes in and that white part has a lot of red lines and it's inflamed, I know that your body's in a state of inflammation. Chances are you may in fact have liver and colon challenges, because the inflammation in your body is impacted by proper liver function. Sometimes you may have a little skin type tab below your eye, and they're called xanthomas. You can say a xanthoma, Dr. Bob? Yes, a xanthoma is a little patch of skin below your eyes that always is elevated in individuals who have too much cholesterol inside of their bodies. And if you have cholesterol that is so prevalent that it's causing little skin tabs below your eye, now they're not brown skin tabs, they're just literally raised levels of flesh, I know you more than likely have congestion in your liver, which is one of the main detoxifiers in your body. As we move down through your body and we kind of go over to where your ears are at, if I have individuals that say to me, Dr. Bob, I have so much wax in my ears. When somebody has a chronic wax problem, I know that they're very toxic, because the body's is using every orifice that it can to eliminate toxic material. See, if you have a lot of drainage from your sinuses and wax coming out of your ears and you're coughing, your body is doing whatever it can to eliminate toxic substances. And when I look inside of a person's eardrum, do you ever wonder what healthcare providers do when they're looking in the drum or in the ear canal? If I see redness Of course, we have inflammation, but the membrane in the back of the ear canal should be a shiny gray color. If I see a dull color, I know that that individual has fluid retention. And I usually see fluid retention in individuals who are quite toxic. At the same time, that's the individual that if I had them squeeze their wrist, they don't feel bone, they feel mass of tissue because their body is in a state of inflammation causing water retention. So the ears are quite significant to me, and if there's earwax, that's not a good body signal. Let's talk about the sinuses and chronic nasal drip and sinus congestion. There's something called environmental sensitivity. In other words, you may be sensitive to something in the environment that's causing you to have a reaction. And what I have noticed is individuals who consume dairy products and peanut butter. Yes, that's right. Peanut butter and or candy products that have peanuts in them tend to have chronic sinus challenges, sinus dripping, and this could be quite an issue. It's once again your body is doing whatever it possibly can to get rid of toxins. My suggestion to you would be to eliminate dairy products and peanut butter for 1 month. Replace the peanut butter with almond butter. And if you have a passionate addiction for dairy products, it's a body signal to me that your body in fact needs calcium, protein, and oil. So what I would do is I would make sure that I'm using flax oil and avocados, great source of oils. Calcium, I personally put sesame seeds on my salad every day, and I eat almonds. We have protein would come from the almonds also. You could use animal tissue, chicken, lamb, turkey. Pumpkin protein powder, a great vegetarian source of protein that help take away the craving for dairy. Sinus problems can also, or sinus congestion or sinus drainage, can also be improved by drinking water from a pure source. Water is the universal cleanser. You want to drink water from a pure source. I personally would not drink water from the tap unless it's gone through some type of purification. There is an excessive amount of chemicals and toxins that are in tap water today. Let's move down. So we talked about the hair, we talked about the ears, the nose, and the eyes. I would like to talk to you a little bit about the skin around your face. And what I have noticed very commonly, if you just pay attention right here on the side of my face, I very commonly see women especially have what we call bronzing or dark spots, especially on their left cheek. And over time, especially after a female maybe has had a child or two, we see bronzing occurring on the face, especially the left side. Something else that I've noticed over time is I'm starting to realize and see that more and more children today, youth, adolescents, have more birthmarks or body spots on their body. When I have somebody comes in that has multiple skin lesions, dark moles, body skin tabs, I know that their body is in a state of toxicity. A very common challenge today, and I know that you've probably seen this also, are individuals will have anywhere from 40, 50, 60, up to 100 little skin tabs around their neck. That's a body signal to me that they're very compromised. Their liver is very congested. See, anytime that you have a skin lesion, especially if this skin lesion is increasing in the volume, that's a body signal of toxicity, and we need to do whatever we can to help eliminate that. It all begins and ends with proper digestion. And you probably have heard over time to make sure that you chew your food. Well, chewing food is very important because it puts saliva in. See, starches and starch digestion starts in the mouth. And you want to make sure that your carbohydrates, your fruits and vegetables, and your grain products have the right saliva because there's enzymes in your saliva that breaks those particles down. What I have learned is individuals who have a lot of fillings in their mouth or amalgams, that's the silver inside of your mouth, that can literally paralyze these glands here in your throat called the parotid glands and the submandibular glands from releasing the proper enzymes for proper digestion. We also encourage our patients to make sure that they drink water before or after a meal. You don't want to drink lots of water during your meal because it's going to dilute the pH, which is acid and alkaline, in your stomach, and you're going to have challenges with your digestion. So you want to chew your food. Can I make this recommendation to you? Don't ever drink ice water with a meal. When you drink ice water with the meal, you're literally stopping the digestive process. Now here's a little nugget for you. I want to talk about your tongue. Do you have a thick, pasty tongue when you wake up in the morning? A part of my experience, there's a term called alma. It's an Ayurvedic term, Ayurvedic medicine term. When you have a thick, pasty tongue, it's a body signal to me that you're quite toxic. Our goal is, if you have this thick, pasty tongue, over time you could brush that tongue with your toothbrush in the morning and it's going to be there the next day. That is your body signal that you're in a state of toxicity. What is your breath like? Do you have foul, stagnant breath that when somebody walks by, it's like, whoa, what is going on? Well, from the back of your throat down to your stomach, there's a long tube. It's called the esophagus. The esophagus is actually the exhaust pipe to your stomach. And if you have poor digestion because you have not been chewing properly and you have not had enough fluid during the daytime to make saliva, what's going to happen to you is you're going to have poor digestion in your stomach, and it's going to be releasing gases. So this whole head, neck, and shoulder above area is it's like a billboard to what's going on inside of your body. Dark circles under your eyes is a very common body signal to someone who has a chronic colon problem. And one last nugget before we move on, chronic sore throats. A chronic sore throat is always associated, from my experience, to a compromised colon. How do you improve colon function? You want to drink more water during the day. You want to make sure that you're having adequate fiber because you want to have a bowel movement on a regular basis. It's cleansing from head to toe. I'm Dr. Bob DeMaria, the Drugless Doctor. Thank you for joining me today.